Good afternoon. I'm Bert, Eichold, Health Officer of Mobile County. I commend Dr. Harris, the State Health Officer, on his new public health order, which will supersede the Mobile County Health Department order, and the governor and her team for all they're doing to make our state healthier. Unfortunately, at this time, I have to report that we have the first COVID-19 infected confirmed case in Mobile County, Alabama. This happens to be a young person, and the report was brought to our attention at 1 p.m. today, under the care of a pediatrician, and is home isolating at this time. To our knowledge, this is the 69th case of COVID-19 in Alabama, and we are the 15th county to be infected. This is a very serious illness. We're sad for the young child that has become infected, but the health of the child seems to be pretty good since they are confined at the home. We cannot give any more information regarding the identification and location of the individual because of the Health Information Act of privacy. So please be patient. The Alabama Department of Public Health will be investigating contacts, in this case, out of Montgomery. So the Alabama Department of Public Health takes COVID-19 very seriously, and Dr. Harris and crew will be conducting the information. As of now, there are 10,442 cases in the United States. That number is increasing with 150 deaths. We must do everything we can to protect the health and well-being of the citizens of Mobile County. We hope to be doing testing in Mobile County as soon as the supplies are released from Montgomery. We have requested supplies multiple times through the Federal Emergency Stockpile, and hopefully the supplies will arrive soon and testing can begin for individuals who just simply want to be screened for COVID-19. At this time, testing is limited by a physician to people who have symptoms, being fever, cough, and so on and so forth. And that's how this young child presented to a private pediatrician who has performed the test. At this time, I'd like to turn the podium over to Dr. Murphy, who is retired from the CDC and our epidemiologist in the Mobile County Health Department. Thank you.
Thank you, Dr. Eichold. So again, news that we were expecting any day now, and so we're not surprised, but also taking it very seriously that we have our first laboratory confirmed infection with the virus that causes COVID-19, again in an adolescent in Mobile County, under the care of a pediatrician and isolating at home, and we think doing very well. So I just want to pass along, as I've done each day, a couple of messages just to reiterate that Mobile County Health Department has consolidated health screening and health services starting earlier this week. We still have our urgent care clinic at the Keeler location, open Monday through Friday, 7:30 to 4:30. Our Newbern Health Center, Friday, 7:30 to 4:30, for well babies only, patients 1 year or younger. And then our WIC services are available Monday through Friday also at the Newbern location. So OB services are offered at the Women's Center, directly behind the Newbern Center, Monday through Wednesday, 8 to 1, and Thursday, 7:30 to 4:30. We have those three lines that we've been telling you about: the COVID information line, which is 251-410-MCHD or 410-6243. Our pharmacy refill line, and again, this is for our Family Health or Mobile County Health Department patients only, 251-445-8635. And for our patients only, medical triage at 251-690-8978. Let me make just a few other announcements, and then I want to talk again about testing and what you should do if you're sick. So at this time, our WIC services continue with business as usual. All WIC appointments and clinic issued formula will be done at the Teen Center, which is located 248 Cox Street, Mobile, Monday through Friday, 7:30 to 4:30. We're asking you to arrive on time for your appointments, go to the front door, and get screened prior to going into our clinic. This is happening at all the mobile health department clinics and at most clinics and hospitals around the city and the county. If you have a pickup or web class due, please call 251 694-3942, that's EWIC, Monday through Friday, 8 to 4, to receive your benefits, so you don't have to come to the clinic. And if you have any questions, again, you can call with the clinic office at 690-8894. I'm gonna get rid of my gun. Sorry about that. So also at this time, physical health is vital, and it's really important to all of us. We want to address some mental health issues. If you're experiencing some stress, we know families and individuals are stressed with finding childcare, grocery store items, businesses are temporarily closed. We've heard about the extra restrictions that are going to be put in place by our state health officer and the governor. And because of this, our Mobile County Health Department, very popular behavioral health Facebook Live series called Wellness Wednesday with Virginia. We'll have a special Facebook Live segment tomorrow, Friday, at 9 a.m. to help families and individuals deal with mental health and stress. Virginia Gordon is a licensed behavioral health professional here at Mchd who counsels on a wide range of topics. So just find @LoveMCHD on Facebook, the same channel as this news conference is streaming. And again, that segment will broadcast live tomorrow, Friday, March 20 at 9 a.m. So just a couple other things to emphasize that Dr. Eichold mentioned. Because we have this first case, the Alabama Department of Public Health will be the lead on the case and contact investigation. So they will be doing a very aggressive contact tracing investigation around this individual. And the state will be assisted by our local disease intervention specialists and our very highly skilled district investigators. Ms. Barbara Gibbs has been here for a really long time and is super gifted at these kinds of investigation, and so we are looking forward to working with this under the leadership of the state. Anyone who's been identified as having close contact with this individual will be expected to quarantine at home for 14 days, monitor their temperature and their symptoms, and report to public health. If anyone who's under quarantine becomes ill, then they will talk to public health and we'll help get them in for evaluation, both medically and for potential testing for COVID-19 infection, if that's appropriate. Also, I just want to talk a little bit about testing. We talk about this, it seems like every day. Why don't we have more testing? Where can we get testing? Who's testing? We don't know who is testing around the county. We think all the hospitals are. There are many clinics and practices that are testing. Again, the pediatrician that identified this person did the test right there in her doctor's office, we're told. And so there's testing going on that we just don't know about. For Mobile County Health Department patients, if you call our medical triage line and you have a history of travel, out of the country or to a state where there is widespread community transmission, and we believe you have symptoms and we believe you need testing, we will help you get that testing. We'll help you get to our sick clinic and do some further conversations and decide if you need to be tested for COVID-19. And there are many providers, again, in clinics and hospitals testing around the county. We just are not privy to what that denominator looks like. We don't know how many negative tests have been performed. We only know now certainty about this one positive case. So someone said to me, if I wanted to buy, a dozen rolls of toilet paper right now and went to the grocery store, there's none on the shelves. I wouldn't be able to buy toilet paper no matter how badly I wanted it or how much money I had or what level of government I was in. And so if the supplies are just not on the shelves and not in stock, Mobile County Health Department and other providers just are not able to get it, right? It has to be there, and as Dr. Eichold mentioned, right now the federal government is sort of diverting resources for testing to areas where they have more of a problem with coronavirus infection than we do. There was one other thing I was going to hit on, but I can't remember what it was. Dr. Eichold, anything else?
I was going to ask for questions from the media, if y'all would like to, between the two of us.
Oh, what to do if you're sick? Sorry.
Okay.
Come on. So again, if you have symptoms like a fever or a cough or shortness of breath, regardless of where you've traveled or who you've been around, we're encouraging you to stay at home and quarantine yourself. Isolate yourself from other people who are well. Care for your illness at home with hydration and over-the-counter meds. If you have a symptom that is too serious to be dealt with at home, then contact your healthcare provider and try to get in for evaluation. But right now, because there's no treatment and there's limited testing, our message is if you are sick with a fever and a cough or shortness of breath, you need to stay at home until you are fever-free for 72 hours. And after that happens and you can be free to sort of move about, still maintaining and following those dramatic mitigation efforts that are going into effect today, and remember your social distancing. So 6 feet, we're about the right distance, Dr. Eichold. So 6 feet, hand washing, cough hygiene, just help us because we need you to help keep the community safe. And I think we'll take questions.
Yeah. I'm not sure who would want to take this one. With the fact that this is a child, potentially may have been going to school while they were sick. That could be getting a lot of other kids, a lot of teachers also having to possibly have been exposed to this. Have people been told to self-isolate at this point, to the best of your knowledge?
Yeah, so let me emphasize that this positive result just came to us today. And so those things that you're talking about are going on right now with interviewing the child and the family and identifying where the child has been the 2 days prior for symptom onset, and then for the duration of symptom until the child is isolated, which is today. So there will just be a couple of days that we will have to do some contact tracing to identify, did they go to school, did they go to after school, were they in any other healthcare settings, did they go to a church, at a scout meeting, those sorts of things. And then all of those people will be contacted by public health, be made aware of their potential exposure, and will be asked to stay at home for 2 weeks under self-quarantine and self-observation.
In the term of your definition of child, is that under 19 and under 18 and under? What is that range?
Or can you release the age of the child?
Yeah, under 19, and we cannot release the age of the child.
So that means 18 or below, not 19.
Correct.
Okay.
Could you clarify, I guess, the difference in how a private lab or a clinic might get tests versus how you would? Because I know there's some sort of chain of command up to CDC that I don't really understand, and I don't think a lot of people do. But I guess when people hear that we can't get tests and then you're saying a doctor did today, could you explain the difference?
Yeah.
I think the issue that we have is mass testing, where we had the drive-throughs and things like that, where you see in other geographic areas. These are limited to a limited number of testing equipment that the doctors actually have on hand, that they have to be very specific and determine who gets tested. So the laboratories have been certified, expanded out. It used to be the CDC alone. The specimen had to be collected at a hospital, and you had to be so sick that you required hospitalization to get tested. The new public health order, not this one that was just released, but reportable diseases, the laboratories are going to be reporting negative tests and positive tests to the Alabama Department of Public Health. So we'll have the numerator and denominator as we go forward. So hopefully the supplies will be released, as we've seen in the national perspective, and thousands of specimens will come to Mobile County. And we can test. Hospitals have been wanting to test, so private hospitals have, through the Hospital Association of the state of Alabama, have been looking for the supplies to do testing. Again, on individual basis, they have a very limited number of supplies, and again, they've just now opened up commercial laboratories that are certified labs to do the test. And so this is all in the process of evolving. We hope that the governor will release 5,000 to 10,000 samples for testing to Mobile County, whether it goes to a member of the Hospital Association of the state of Alabama wants to do the testing, whether it goes to a municipality, whether it goes to the National Guard or to the Mobile County Health Department. We want people to be tested. And again, we have been unsuccessful. Dr. Harris was just in the governor's office with this new announcement, and the governor has a COVID-19 task force that has lots of people involved in. And again, that has been, mass testing has been a limitation at the federal level, but maybe that's getting ready to change, and we hope so, but we need to let everybody know we do have a case in Mobile County, Alabama.
I'm not sure who'd want to take this one again. With the fact that State Representative Shane Stringer is saying that they will soon be opening a testing site, a drive-through testing site in northern Mobile County. That is a rural area. Wouldn't you want the first drive-through testing center be in an area where there's a lot more people, in maybe central Mobile? Wouldn't that make more sense?
I think that we're trying to reach out to Representative Stringer at this time So I'm not sure where he's talking about in the north part of the county. If it's on the I-65 corridor, there are lots of people who go up and down I-65 on a daily basis. So I have no knowledge of where he is talking about putting this testing site, nor do I have any knowledge that he has gotten access to the testing material. And remember, the most important part of the testing is personal protective equipment for the medical and healthcare providers. If we lose our medical or our first responders because we have not adequately protected them while doing mass screening, that's going to be a significant problem for our community.
Is that good news that it does sound like that there may finally be a drive-through testing center for people who feel they haven't?
Oh yeah, we'd love to test 10, 20,000 people in Mobile County if that were available. We need good information about the population and how much this virus. I was asked in previous press conferences, did I suspect there was a case in Mobile County? And I said yes. I just don't know how many cases we have. Now we have one confirmed case, so I'm sure it's in Mobile County at this time. But how many other cases do we potentially have? And how many people may be infected and asymptomatic is important, because we think there's a pre-infection component to this where that you are exposed and you have virus and you can infect someone else, but you are not showing any symptoms of illness. And the last thing we want to do is that people who may be exposed to test them to know that they're not going to be shedding virus, especially to the elderly and those who have underlying medical conditions who are at greater risk.
With this, you guys have always been saying 65 and older, people with pre-existing conditions have the most to worry about. This is a child who got it. The first case in Mobile County is a child. What is your message to people out there right now? The fact that this is not somebody who would have been a couple weeks ago, everyone's saying you need to be worried if you're 65 and older, pre-existing conditions.
Well, I think for long-term health consequences, the data is pretty good that children do better than older folks with this particular illness. I am surprised the first case is a person less than 18 years of age, but it does not, as mobile as our society is, and people going to so many different places, children were actually listed in the literature as actually being a harbor of COVID-19 virus and not symptomatic. So I think the data shows that this will be a more frequent occurrence as we get more information in testing.
As the health officer of Mobile County, should young people take note that this is the first case here?
I think everybody should take note, young and old. Everybody should socially distance. Everybody should wash their hands. Everybody should take this seriously, because everybody is at risk. Nobody has immunity. There is no vaccine, and there is no antiviral for this medication.
Has the family of this child been tested? Do we know if any of them are positive?
Good question. Has the family of this child been tested? And I will tell you, I do not have that information at this time. It was at 1 o'clock today that the test was confirmed positive, and I will assure you that that will go forward by the Alabama Department of Public Health. That will be part of their close contact exposure but they're doing that out of Montgomery, and that should be something that I would assume would occur unless the individuals decline to be tested.
I think, so generally, when we're doing a contact investigation around a confirmed case, we ask people to quarantine and monitor their symptoms. We have to be careful about testing people too early, because the test could be negative if there's no detectable virus, in that nasal swab. So generally, we would wait until we saw that very first maybe low-grade fever or dry cough start, and then pull specimens for testing on those close contacts.
You mentioned that you would love to do mass testing as soon as supplies arrive from Montgomery. Is it a supply issue or a bureaucratic issue at this point? Do we know?
It's a supply issue. I mean, this is an unprecedented pandemic, and all over the world we need swabs and transport media and laboratory assays. And so we're being asked to put our orders in, and we do that every time we get the opportunity. And then we think we're going to get some supplies delivered, and then we hear the orders were canceled and pulled for federal assets where they're needed more.
And obviously, there's the regular flu is out there. It's also a case, some people have bad allergies, so
Yeah.
people are frightened when they get a feeling in their throat or is there a temperature that someone, if your temperature gets above a certain amount, then get to at least contact your doctor? I know just not walking into an emergency room, but what are some of the symptoms that if this is in fact the case, you need to contact someone and just not stay at home?
So it's 100.4. Although we've seen some recommendations that if you're 60, 65 or older, we may look at people who have a temperature of 99.5 in older populations, because they may not, they may not have as high temperatures as some of the younger population, but there's not a magic formula. And whether you get a test or not, the medical recommendations for managing your illness is the same. Stay at home. If you can manage your illness at home, stay there. Hydrate, use over-the-counter meds, and only enter the healthcare arena, go to your doctor or go to emergency department if you absolutely need that higher level of care. And it's hard. We've had hundreds and hundreds of phone calls over the past couple of days of people who have exactly what you described. They have allergies, or they maybe think they have a sinus infection, or they have a cough, or their child has a fever, and they're really worried that they may have coronavirus. I can't tell them that they do or they don't. We can't test everyone who wants to be tested. Maybe we'll get there one day, but right now we can't. And so right now we have to rely on those community mitigation measures and try to encourage those people to do their part to keep our community healthy by staying at home until they're fever-free for 72 hours.
Are you able to definitively say right now that when that test was conducted on that child, that whole family was quarantined?
I can't definitively say, but we've gotten good intelligence that has happened. Again, Montgomery's leading the investigation, but they have been doing this now for 88 other cases. So they likely are pretty good at it by now. As I mentioned, 68 other cases. We think we're the 69th. So it is happening. And as I mentioned, there are other staff, disease investigators throughout the state that are being pulled in to help make sure that these control measures around this case are implemented appropriately.
But they would have, when that test was conducted, that pediatrician most likely would have told that the child's mother or father and that whole family that they probably should self-quarantine until we get the test back.
Absolutely, simply because they had a cough, right? That's the message. Go home, stay at home until you're feeling better. Regardless of whether you get a test or not, or regardless of whether the test is positive or not.
Please go over HIPAA again about how we can't identify the lady.
Yeah, so do you want to talk about not being able to reveal information on the confirmed case due to privacy?
Yeah, HIPAA is a federal law that protects each and every one of us for privacy, and we cannot disclose any information that would allow someone in the general public to either by age, sex, high school, geographic location to identify who this patient is. So we've got to be very cautious, and I think you have to realize that the Public Health Department will be contacting those individuals who could have been exposed, probably by telephone, after they do the primary case investigation and get more information from the patient and the patient's family, and then they will follow out the circle of those who have been exposed. Yes, sir.
HIPAA is a federal law, correct?
Okay.
Is there a specific reason why places like Florida will give the age and the gender, and you guys won't?
It depends on, yes, we're probably overcautious. There's a larger population in the great state of Florida, so when we say provide more information in Mobile County, we're over only 400,000 people in Mobile County, so we're very cautious to be where this actually location is, and I'll yield to.
Yeah, I was just going to add that Dr. Eichold is exactly right, that some of the time it matters more about the denominator than the numerator. So Florida has a much larger population than we have, and in Mobile County, if we were to divulge the sex, the age, the zip code, then we're basically identifying that person because the population is so small there. So that's why we can't do it, and we have to protect the privacy of the individual.
So this is the choice of the Mobile County Health Department or the Alabama Department of
No,
Health?
this is following the federal privacy rule.
So then, okay.
I'm still curious about the test. Is this a days? Will it be days? Could it be hours? How long until they get the test that you mentioned from Montgomery? Is there any way of knowing?
You know, there is not. Like I said, we have placed orders and we've been told we get the supplies on this date, and then the orders get canceled, we place other orders, then we get another date, and so there's really no way to tell. The important thing is that, you know, others, as you've heard, are talking about standing up drive-through or mass testing facilities. The Mobile County Health Department has been planning to do that for at least 10 or 12, 14 days now. And we were all ready to go and get it rolling earlier this week, and we just were not able to get the testing supplies. Those plans are still in place. Those sites are identified, the staff are identified. So as soon as we get enough specimens that we think we need to carry on those operations, we will do that. What we don't want to do is open up a clinic, you know, a drive-through testing clinic on one day and have to shut down 3 hours later because we've run out of supplies.
Advancing the story, this kid who was infected with the coronavirus, what happens a month or a couple weeks from now? Can they get sick again? Can they, will they be able to go back out in the community?
Yeah, so there is a very rigorous algorithm that's put forth by the Centers for Disease Control about what benchmarks would allow this patient to, you know, be able to return to moving about the community, so basically come out of isolation. I can't quote it verbatim, but it has to do with having several negative tests, being without fever for 72 hours, it being at least 7 days beyond the first symptom onset. So there's an algorithm that's published by CDC that will provide guidance about when this child will be able to come out of isolation.
Can they get it again?
I don't know. I mean, there was some speculation about that in the beginning. I don't know. It's unlikely, I think, is what we have been saying, is that based on what we know for the largest majority of the people, we're not seeing reinfections. We are beginning to worry a little bit about co-infections, so maybe being co-infected with, you know, another respiratory virus or maybe some other bug, but right now, reinfection, it's maybe a little bit too early to call that.
Reinfection this year or reinfection ever again?
I think both.
Yeah, we don't have enough information to talk about that. There are a tendency to potentially have a relapse from an infection. So you get feeling better and you're going again, and then you have a relapse as you've never really cleared all the virus, and then you find yourself under stress, and then you have a relapse of the infection. Like with the flu, we get flu shots on an annual basis, but that strain changes and you can get infected the next year, so that's why we get flu vaccines on a regular basis based on strains. This is different than the flu, but we just don't know enough about, like with other infectious disease, where you have lifelong immunity after having had the illness.
Can you talk about the curve if you've got time? Just you mentioned where we were on the curve before the press conference started. As far as
I would refer everybody to the CDC's, you know, website, and also Johns Hopkins University has a site. But we are down, if you look at the United States, as we're down at the bottom, and you look at what's going on in Italy, it's real steep curve. And then what's happening now in China is it's plateauing off, and the new infections and death rates in China after 90 or 120 days seem to have platformed. And what we want to do is we want to try to avoid, is we're starting to see cases increase in numbers, which is every day, every single state around Alabama and in the United States, case going up. Hopefully we can break this reinfection, or this spread of this infection, so it does not get up to tens of thousands or hundreds of thousands of people infected.
A question coming from our newsroom. You guys yesterday mentioned that, or showed me from the Alabama Department of Public Health, about a little less than 5% of the population reporting flu-like symptoms. I believe that's the way it's phrased on the Alabama Department of Public Health, not a confirmed case of the flu, but a flu-like symptoms type of thing in the Mobile area, a little less than 5% as of the ending last week. Is there some sort, are we seeing a lot of flu cases in addition to this? Is the flu more widespread than the coronavirus? Is strep also widespread? What can you give us that insight?
Yeah, flu is much more popular in our community and in the United States than coronavirus as far as number of cases. this is actually a longer flu season than we normally see. So we can test very easily for the flu A, flu B, but I will yield to Ricky.
Yeah, so, flu season usually starts winding down about this time. So we're happy to see that. We don't know if coronavirus like flu will wind down at the end of spring, early summer, or if it will stick with us. So we'll just kind of have to see how it behaves over the coming months and that sort of thing. So any other questions for Dr. Eichold or myself?
We appreciate it.
Okay, thank you all for joining us. I was trying to get that TV to turn off. Is that